Sure.
I'll start. Uh, Good afternoon and hello everyone. Today we will be talking on oocyte cryopreservation and the benefits of oocyte cryopreservation. So over the last few decades, there has been a lot of advancement which has been happening in the human assisted reproductive technologies. One such advancement is in the field of cryopreservation. So as we already know that sperms and embryos can be cryopreserved over a long period of time. But with the recent advances, even the eggs can be cryopreserved. Uh, so, what exactly is egg freezing? Egg freezing, which is also known as oocyte cryopreservation or oocyte preservation, is a process in which the eggs are extracted from the ovaries of a woman and then they are stored and preserved in favorable environment over a period of time. So, whenever the woman desires fertility, eventually these eggs are thawed or they are warmed, and then the fertilization is done with by the process of ICSI with the husband's sperms, and eventually these embryos which are formed are transferred into the uterus of the woman, thus attaining fertility. So, as we already know that there is a major difference in the fertility potential of men and women. Whereas a man can continue to produce sperms even at advanced ages, the fertility potential of a woman goes on declining as the age advances. Even there is some decrease in the quality of the eggs which are produced. So, to avoid these problems, egg freezing is an option which the woman can opt for. The first live birth following egg freezing was reported in the year 1986. Oocyte cryopreservation was a major issue in the initial years of cryopreservation. Oocyte is the largest cell in the human body. As compared to the embryos and sperm freezing, oocyte cryopreservation has been difficult and tedious, but with the advent of vitrification technologies, oocyte cryopreservation has become easier. So, what exactly is the process of egg freezing? So, in the initial part, the egg freezing cycle is very much similar to an IVF cycle, where over a period of 10 to 12 days, hormonal injections are given. These hormonal injections are given basically to stimulate the ovaries so that they produce mature quality of eggs. Once the 10 to 12 days of injections are over, these eggs are extracted from the ovaries by a small procedure which is known as oocyte retrieval. Over a period of 10 to 15 minutes, this procedure is done under anesthesia. Eventually, these eggs which are extracted are analyzed in the labs, and the mature ones, which are also known as M2 oocytes, are frozen by a process which is known as vitrification. So, vitrification is the most recent advances which has occurred in the field of cryopreservation. Vitrification is an ultra rapid freezing technique where the oocytes can be preserved at minus 196 degrees Celsius in liquid nitrogen. There is no effect on the quality of the oocytes over a period of time. So these oocytes are then, when the woman is ready to conceive or when she is married, these oocytes are thawed or they are warmed, and then eventually the fertilization process occurs with the help of husband sperms. The embryos which are formed from these oocytes are allowed to grow or they are cultured in the lab for up to day 3 to day 5, and these embryos, the best ones, are generally transferred into the uterus so that the pregnancy is achieved. So this was about the process of egg freezing. Now, who should actually consider the process of egg freezing? So this is a major question which comes to minds of many people. So generally, the indications for egg freezing are generally divided into medical and non-medical indications. Medical indications are the one in which the woman is suffering from some diseases or conditions wherein egg freezing is advised so that she can go ahead with the treatment part. And non-medical indications are generally for the woman who will face the issue of infertility with the advancing of age. So medical indication generally includes the women who are suffering from cancers, who have been advised chemotherapy or radiotherapy. So as we know that chemotherapy or radiotherapy have detrimental effects on the ovaries and hence the oocytes. So before undergoing the treatment, the women are generally advised to go ahead with egg freezing. Other indications include grade 4 endometriosis. Now, endometriosis is a non-malignant condition, but it goes on increasing over a period of time. So, in endometriosis, the quality and the quantity of eggs is deteriorated rapidly as compared to a normal patient. So, any patient with grade 4 endometriosis should be advised to go ahead with egg freezing. Other conditions in the medical part generally include if the woman is having premature ovarian insufficiency, where before her age the egg count or the ovarian reserve is on a lesser side. So to avoid the problems of fertility at a later age, such women are advised to go ahead with egg freezing. Also, if the woman is suffering from some genetic disorders, they might be advised to go ahead with egg freezing. There is another option of ovum banks where the donors are advised to go ahead with egg freezing. Other than this, the major part is the non-medical indications. So in non-medical indications, this part of egg freezing is also known as social freezing. So in this, the age-related fertility decline, which inevitably every woman will be facing eventually, this part is covered in this. So this type of egg freezing is known as social egg freezing or planned oocyte cryopreservation. In planned oocyte cryopreservation, generally the women in their 30s are advised to go ahead with egg freezing if they are not planning pregnancy or motherhood anytime soon. So in 2013, up to 2013, egg freezing was generally considered an experimental thing. But in 2013, ASRM approved it for the treatment as a treatment option in the patients with cancers or oncology patients. And in 2018, egg freezing has been approved as a treatment option for the patients with who want to avoid age-related fertility decline. So in 2018, social egg freezing has always also been approved. So this is basically about the indications of egg freezing. Now, what is the ideal age where a woman can go ahead with egg freezing? So generally it is advised as per the data and as per the studies which are available. The ideal age for a woman to go ahead with egg freezing would be from early 30s to mid 30s, which is generally an age group of 32 to 37 years. Egg freezing in a very young age is generally not advised because those patients might, irrespective of the egg freezing, might conceive at an early age, and egg freezing at a very advanced age in more than 40 years is also not advised, because as we know that the number and the quality of the eggs, it goes on reducing rapidly as the age advances, and it is more rapid after the age of 40 years. So if a woman more than 40 years goes ahead with egg freezing, the number of cycles of egg retrieval would be more, which would cause a more mental, financial burden on the patient, and eventually the outcomes also might not be very much in the favor. Also, there is a chromosomal risk of chromosomal aneuploidies, which can be seen in women with advanced age when they go ahead with egg freezing. Also, there might be some issues when where the eggs are not able to go ahead with the process of freezing and thawing, and hence eventually they are not able to survive this process. So generally the ideal age group for the women who can go ahead with egg freezing is between 32 to 37 years. So the next point is like how safe is this procedure in terms of the women and eventually the offspring which is born. So the risk of women who undergo egg freezing or this procedure is very much similar to the IVF procedure. So whatever risks are associated with the IVF, associated with the anesthesia or the oocyte retrieval, or eventually in a woman with a lot of eggs if they are present, there can be a risk of OHSS, in which there is swelling of the body parts, there is swelling of the abdomen. But all these things are very much similar to the IVF procedure. And the other risk, the main part is many people which they have the question is how is the baby born through egg freezing? So basically, as per the report, as per the data which is available up to date, the offsprings of a woman who have undergone freezing and eventually thawing are generally totally normal, and the risk of aneuploidies or any chromosomal abnormalities is very much similar to the one which is seen in any natural pregnancy. So there is no added risk which is seen to the mother or the offspring who go ahead with the process of egg freezing. Now, what is the success rate? So success rate is an important question regarding egg freezing. So success rate generally it varies. Generally, if the woman less than 35 years of age go ahead with egg freezing, so the number of eggs and the quality of eggs is generally considered good, and hence eventually the success rate would be on a better side as compared to a woman who is more than 35 or 37 years of age. As the quality and the quantity of eggs is compromised, the success rate might be on a lower side. So on an average, the age and the ovarian reserve is the most important factor which gives the success rate in a woman who is undergoing egg freezing. So if a woman less than 35 years of age goes ahead with egg freezing and some 10 to 12 eggs are retrieved and they are frozen, and it is generally expected that if the quality of eggs is good, then eventually the process of thawing or warming, at least around 80 to 90% of the eggs would survive the procedure. And when the procedure of ICSI is performed on these eggs, at least 50 to 60% of them would progress to form embryos. So the successful pregnancy rate in such patients is around 18 to 32%. This is the success rate of egg freezing, but obviously it varies with the age and the ovarian reserve of the patient. So what are the benefits? Now this is the most important point of egg freezing, that why should a woman undergo this process. So as we know that there is a social trend these days where the women get married at a later age and eventually plan motherhood also at a later age. This is mainly due to education or career, or if they are not able to find the right partner. So in such cases, the woman can definitely think about this social egg freezing, where they can go ahead if with the egg freezing procedure in their 30s, if they are not planning to get married or have children anytime soon. So in this process, the women just have to freeze their eggs, and they can eventually preserve their fertility and plan pregnancy whenever they want to. So when they get married, these eggs can be used to plan pregnancy. So that is the most important point here, that the fertility is preserved. Also with egg freezing, there is no deterioration in the quality of the eggs. So if a younger woman undergoes egg freezing, the quality of eggs which we get would be better, which can be eventually used for pregnancy, as compared to a woman more than 40 years who is having a lower reserve, and obviously the quality of eggs is also on a lower side. So the eggs which will be retrieved would not be of a great quality, and eventually the pregnancy rates also would be on a lower side, and also the woman and the offspring would be at a risk of aneuploidy. So the child born might have some genetic or chromosomal issues. So it is better to have one good quality egg rather than three or four less or low quality eggs. So that is the main point. So it preserves the fertility, the quality of eggs is retained, and obviously it will get the stress out of the mind where the woman undergoes this procedure, so that she can plan or live the way she wants. Because once you know that the fertility has been preserved, eventually the stress factor would be on a lesser side. So it also reduces the mental stress. So these are the main benefits even in the patients with cancer or endometriosis. Once the fertility is preserved, eventually planning pregnancy would be easier. So egg freezing can help the patients or the women avoid the risk or the point of taking a donor egg eventually in their life when they plan pregnancy and marriages. So this is how it is. So egg freezing, social egg freezing is something which has come up these days, and a lot of people have a lot of questions regarding it. So it can definitely be undertaken. The age is generally 32 to 37 years, where the women can store their eggs, and these eggs can be eventually used to plan the pregnancies and have babies. And this is basically in short about egg freezing. Thank you so much. We will wait for some time.
How many eggs should I freeze?
Let's start. So we have, yeah, so we have got one question. The question is basically, how many eggs should I freeze? So generally the number of eggs, if it is more, the more the eggs, the more it is better actually. So generally it is indicated that at least 18 to 20 eggs should be frozen, so that once the process of thawing is done, eventually when they are planning the pregnancy, at least 80 to 90% of them should survive the process of thawing, and at least 50 to 60% should eventually form the embryos. So if we are freezing at least 18 to 20 eggs, then at least there is an expectation that these eggs will form at least 8 to 10 of them will eventually grow to form the embryos. So with one transfer, this is because this is not a 100% process. With one transfer, there can be a possibility of getting pregnancy, but then if the pregnancy doesn't happen, then we may have a stock of embryos which can be used eventually. So yeah, generally the recommended number would be around 18 to 20 eggs. So that can be done in one cycle if we get those eggs, or if not, then we can go ahead with maybe one more cycle, so that the number is fair enough. Sorry, I can I can give the end note. We will not wait more. Oh. So in the end note, I just want to say that because of the recent advances, oocyte preservation or egg freezing is a latest thing which has come up, and any woman who is single or not planning to get married soon can plan to go ahead with this procedure, and thus preserve their fertility, so that eventually the issues related to pregnancy or the age related decline in fertility which every woman will be facing can be avoided. So we have one more question regarding whether we have any successful pregnancy at our center with frozen eggs. So actually speaking, because this is a recent thing which is available nowadays, so initially it was just the freezing of the sperms and the embryos which was done. So actually in our center we have not received a lot of patients who want to go ahead with egg freezing. So we actually in our records we do not have any pregnancy which was done of the frozen thawed eggs. So we don't have the cases, but definitely as per the data which is available and as per the studies which are available, the live pregnancy rate after frozen and thawing of oocyte is around 18 to 30%.